Hi, I'm Emily from Respiratory, and I'm here to help with the intubation. First, going to decontaminate my hands using hand sanitizer. I'm going to apply gloves. Okay. For intubation, we like to have oral suction. So I'm going to set that up, but first I'm going to identify my patient. I'm going to look at their wristband. My patient is not conscious currently, so I'm not able to ask them. I'm going to still verify their identity. Then I have all my equipment gathered. I'm going to gather my equipment for suctioning to have on standby. I'm going to hook up. That one on. Where I'm going to set it to less than 150, I'm going to set it to about 145. End of my suction. To show me, yep, it is indeed at 145-ish. I'm going to keep this on standby, but for the use of this video, I'm going to turn it off because of the noise that it creates. Also, my patient would be facing the other direction, but we have this head of the bed on it. So we are going to pretend like the patient's facing this way, and the suction would be closer to the patient then, so it would not be falling off of the bed. I would remove any pillows or anything under patient's head. I would extend like so. I would pre-oxygenate my patient, and then going to get this and check it, attach it. Check for the light. There is indeed a light end of it. That's great. I'm also going to check my cuff using the syringe. I will inflate, check. My cuff is not deflating, which is not. I'm going to make sure to uninflate to prepare for insertion. I have already put a lubricant on my tube. So now I am going to prepare to insert the tube. I'm going to, again, make sure that, I'm going to have the stylet inserted, making sure that it is not sticking out of the end. Going to move from in a sweeping direction from right to left to move the tongue. Okay, and I'm going to try, move the neck again. Going to try to get a visual, and now I have that visual. I am going to insert my tube, going black lines. Once inserted, I can remove this and insert air into the cuff. And remove stylet. I'll now confirm its position, having going to deliver bagged breaths, and I see the inflation, but I'm going to do 5-point auscultation, where I would have somebody give the breaths and somebody else would listen to 4 points on the lungs and 1 on the stomach to make sure that it is not inserted into the esophagus and is in the correct place. And then I will then use my CO2 detector that I would attach in between the tube and the bag. I would give some breaths through that, wanting it to show up as yellow and not purple. After confirmed, I would then secure my tube's placement like so. I would put this above, wrap this around securely, but not too tightly. Put these on the cheeks. I would remove the sticky pads on here on a real person. I'm going to pretend in this case that I'm having a partner hold the tube in place while I do this, because it just does not feel practical to do it on my own. This, get it nice and secure. Okay, now that I have it secured, now I am done, and now I will decontaminate my hands and my equipment, put everything away. I would request a chest x-ray to confirm the placement of the tube, and yes, so I would decontaminate all of that, throw away my gloves. I don't know where garbage actually is in this room, but I'll pretend like I'm throwing that away. Sanitize my hands, ask if anyone needs anything else, and if they don't, then goodbye.